Welcome. In this video I'm going to talk about sputum production. In a definition of the sputum production, sputum is a mucus that is caused out from the lower airways. Sputum samples are usually used for microbiological investigation of respiratory infections and cytological investigation of respiratory system. It's important to know that it's pulmonary disease relation. In order to understand the sputum production, it's important to know how is the physiopathology of the pneumonia, principal example of the sputum production. As we can see in this video about the pulmonary disease, pneumonia.
Pneumonia is inflammation in your lungs caused by an infection. You have two lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels, called capillaries, surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. If you have pneumonia, your airways or lungs have an infection caused by germs, such as bacteria, viruses, fungi, or parasites. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you may expel them by coughing. Sometimes germs make it past your mucus and cilia and enter your alveoli. Normally, cells of your immune system attack these germs, which keep them from making you sick. However, if your immune system is weakened due to age, illness, or fatigue, pneumonia-causing germs can overwhelm your immune cells and begin to multiply. Your bronchioles and alveoli become inflamed as your immune system attacks the multiplying germs. The inflammation causes your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. If you have lobar pneumonia, one lobe of your lungs is affected. If you have bronchopneumonia, many areas of both lungs are affected. Pneumonia may cause the following symptoms: difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue.
That was about pneumonia. Continuing with the sputum production, we can see the best sputum sample contains barely of saliva, and this contaminates the sample with oral bacteria. A good sputum is more than 25 squamous epithelial cells as low, enlargement indicates salivary contamination. In acute bronchitis is another example in how the body tries to eliminate the bugs in the body forming a problem oxidize. This is a reason for whole acute syndrome. In this video we can see and understand more precisely about the acute bronchitis. Continue with the performance. We have the types of the sputum: bloody, a purulent, and foamy white obstruction. The foamy white is an indication for obstruction or edema, a 40 ping is indication for pulmonary edema. About the risk factor on chronic sputum production is also related with the habits that people have. For example, it's normal to find a great sputum production in people who smoke every day and it's normal. For the pregnancy that we can see is the kind of habit. In this video we can see how much dangerous the smoke.
Eliminated his hacking coughs, phlegm, wheezing and suffering the moment he unlocked the ultimate secret formula to completely eliminate his dependency on prescription antibiotics, costly doctor bills and completely cure his bronchitis. Most doctors won't think twice about treating your bronchitis with antibiotics. The problem with antibiotics is that they kill all the beneficial bacteria in your body, along with the bad. After extensive testing and trying different remedies, I found that by mixing certain easy-to-find natural ingredients and kitchen items, I could give myself almost instant relief and destroy the germs that were causing my bronchitis fast. For more information, click the link in the description of.
Until now we have the blurring sputum. Blurry sputum is a blood streak sputum, inflammation of the throat, bronchi, lung, cancer. A pink sputum is indication for a sputum heavily mixed with blood from alveoli and small bronchi. Massive blood is a cavitary indication for a cavitary tuberculosis of lung access, bronchiectasis, infarction, and embolism. In this continued video, the increasing of the is kind of resumed. The increasing of the mucus is a normal reaction to recurring irritant injuries to the lung. It's important that gives those organs the correct care of and try how much is possible to avoid noxious injury. Now, as I say in other videos, in this video you can find the person that can complete all the videos to understand more about sputum production. Finally, a pollen sputum is a yellow greenish mucopollen color suggests bacterial infection. Green color is caused by Neutrophilum myeloperoxidase. White, middle, or opaque mucoid is appearing often means viral infection. The sputum production. This performance has been created to explain with examples the physiology and physiopathology of the sputum production as a way to defend the body against avics, virus, and bugs that try to make a huge damage in those things.